Are you good?
Yes, I am.
All right, thank you. So, forgive me, like this was just happening. If it was a technical, a technical session, they would run in here. But when it's held until they are down, just like Ayo Adi, he was working, he was doing all night for the last 2 weeks, and landed him in the hospital. I had to force him to come here and come and learn. So, God will help everyone of us. Yeah, we just going to introduce Dr. Winnifred right now, and then we'll go ahead with the session. So Dr. Winnifred is a medical doctor and surgery resident with hands-on experience managing complex clinical cases across general surgery and urology. She has a foundation built in high pressure hospital environment. She brings a unique frontline perspective to health and wellness conversations. And my interest in the intersection of professional performance and personal well-being drives her passion for helping others optimize their health systems before things crash. And so today she's going to be speaking to us not just as a medical doctor, but as a medical doctor who understands the intensity that comes with working in a high stake environment. As professionals, every one of us are working in a high stake environment. Everybody can have a strong impact in the business. So she has that perspective, she has the experience, and she's coming with all the experience, just with insights that can answer our questions as regards our health. And I've also known Winifred for a while as well, almost, not almost, more than 10 years, there about 10, 11 years. And really nice to have this conversation with us. So as we go along, if you have any questions that comes up, please feel free to drop it in the chat or raise up your hands, and back to you, Dr. Winifred.
Okay. Hello, good afternoon, ladies and gentlemen in the data field. I'm Dr. Ibeanu Chindo Winnifred. Thank you so much, Mr. David, for the introduction. Yes, we've known for more than a decade, and if I'm correct, I think 14 years to be precise. I'll be taking us on this wellness and health presentation. The title I was given, or the topic I was given, is debug your health. We are trying to fix the errors before they crash the system. So I'll go on ahead to share my screen so we can go through the presentation together. Is that all right?
Yes, 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 yes. Thank you. Thank you.
Okay.
Yes, I can see your screen.
Okay.
I think you should stop sharing. I was seeing
Okay.
this.
Okay, that's fine. We can see the screen now. So I can
Yes, yes,
go.
yes. Yeah.
Okay, so this topic is really important, especially for data professionals, because the remote work we do now has fundamentally altered how we live, work, care for our health. And if we don't set some boundaries, between our work and our lifestyle, our health, our bodies tend to pay the price, just like Mr. Ayo that's landed in the hospital. Because I mean, you are going to be my index case in this presentation. So as other professionals, I think it's important that we apply evidence-based care to ourselves first. So I'll go on ahead to give us a little data about the global health crisis that affects remote workers. We have more remote workers in the USA. I mean, USA usually has more data, so I thought about using it in this presentation. While in Nigeria, mostly in Lagos and Abuja, we have about 2.8 million remote workers. And as we go on ahead in development, we will tend to have more remote workers than we do currently. So, in all of this, at least 43% come to the hospital with complaints of neck pain and back pain and muscle pain. Some of the health data professionals come with mental health impact. That would be 37% of them with anxiety and depression. This mental health impact is because of the mental workload and the stress we put on ourselves in order to, beat deadlines. Usually we are sedentary in the kind of work we do. We tend to sit all day and stay on our screens and work more than 8 to 10 hours actually. So you can sit uninterrupted for a long period of time because you have a lot of things you want to get to. So okay, this is a health word, metabolic syndrome. So 32% of data professionals come down with metabolic syndrome. So the body has a way of working and breaking down the things that we eat and trying to adjust to how we live. That is what we call metabolism, right? So metabolic syndrome is some constellation of signs and symptoms that occur as a result of our body not being able to function as it should. So examples of this metabolic syndrome would be elevated blood pressure, elevated cholesterol level. We usually say high cholesterol level. Cholesterol is just the amount of fatty acids that we have in our bodies, and if it goes high, we don't like that, especially in the hospitals, because it can increase the risk of stroke and heart problems and heart diseases. So I'd like to just put into practice. For me, even as a surgery resident, I've been working back to back long hours, and I'm not sedentary. I'm not in one place. I tend to move around. Some days I clock about 10,000 to 15,000 steps. But even at that, I've realized that if care is not taken, I could develop some diseases if I don't, set some boundaries between the way I work and the way I allow my work to affect my health. So when I started this residency, I thought, just be resilient, just be strong, just put in your best, you get to have a good outcome. So in the second month, I started having some lower back pain. By the third month, even till now, I've started having some disrupted sleep patterns. I've been having some level of sleep deprivation, you know, and you tend to skip meals. You tend to forget that you are working, that you have to eat even while working. I mean, you have a patient you are seeing, and a patient is after, and patients do not care if you have eaten or not. So that burden is on you to actually care for yourself. So in trying to put together this presentation, I just want to let us know that our health is not a luxury. We shouldn't wait for our health to get bad before we go visit the hospital. So there are some risk factors that affect us. These are things that when we in our course of working, they can affect our health negatively. I've mentioned before sedentary lifestyle, it can lead to loss of muscles. Muscle atrophy means loss of muscles. You know, usually we go to the gym to build our muscles. If you are sitting in one place for a very long period of time and you're not working those muscles, you'll tend to actually lose the muscles. There's something we call disuse atrophy in medicine. It's when when you don't use a particular thing as you should, that thing tends to die, sort of. Like if you're not using your muscles actually tend to decrease in their size, actually. So we have muscle atrophy, we have weight gain, and we have our cardiovascular decline, our health problems, our heart problems that can occur. And like I showed us before in our data in the beginning, there's about 43% increased cardiovascular disease risk. We tend to make poor diet choices. Sometimes we forget to eat, and when we eventually eat, we don't eat the right thing. This can lead to, you know, problems with the way our body functions, as the metabolic dysfunction and nutritional deficiency. So when we are talking about nutrition, it can be malnutrition or it can be overnutrition. You can be eating more than you should, or you might be eating less than you should. So we have to find a balance so that we can give our bodies the right meal and at the right time. So lack of exercise has so many benefits, and lack of it would, impact our health negatively. There's another part. This is the mental path, the lack of community. You have social isolation, depression, and anxiety that can result from, when we are not talking with other people, we're just focusing on the screen, on our work, on the work that we need to get done. We have poor health seeking behavior. You are home and home is a bit comfortable, and you have a headache and you refuse to tend to that headache because, I mean, I've been in the house and there is no reason why this headache cannot go with just little sleep. Headache can go from a mild headache to a stroke headache, if you understand what I mean. The things that can cause headache is very widespan in medicine, that sometimes when patients come to us and say they have headache, we are worried. Is this just a simple headache, or is it a headache that this patient is having because their blood pressure is not well controlled, or because this patient is about to have a stroke, or because this patient has a tumor like a brain cancer? Some people with brain cancer, they just present with headache. So usually we do not want people to just sit down at home and do some home care just because they feel this is not enough for them to present to the hospital. So circadian rhythm disruption is from poor sleep, from sleep deprivation, from insomnia. Circadian is how our body works. So our body has a way of functioning even with the weather. When by 8 a.m. when the sun is coming up, we tend to wake up. At 8 p.m. when the sun has already set, our body tends to wind down. So when you continue to work, when your body is supposed to be winding down, it can lead to metabolic dysfunction. Your body starts to release some stress hormones that can keep you going. One of those stress hormones is cortisol. If it continues to do that, to do that, you tend to lose the actual circadian rhythm that should allow you to sleep for like 6 to 8 hours, wake up in the morning, and continue to function like you should. Next is the health problems associated with these risk factors. I've mentioned some of them already. The major thing, the neck pain, the lower back pain, the shoulder pain. Now, the thing about pain in the muscles and in the bones, like I mentioned about the headache, this pain can be, it can be mild. It can be because the muscles are just sore or the muscles are stressed. It can also be because the spine is now having problems. How do we know this if you don't come to the hospital? Like I mentioned, metabolic syndrome has hypertension, elevated blood pressure, dyslipidemia. Dyslipidemia means elevated cholesterol level that is not good for us. Hyperglycemia means elevated sugar levels. This can lead to diabetes. We have the cardiovascular risk, increased atherosclerosis. What is atherosclerosis? Atherosclerosis is in our vessels. So we have our hearts that beat, and in our hearts we have pipes. These are arteries that go to supply blood to different parts of the body. So these arteries are elastic. So they work in a certain way in order to ensure that blood moves from the heart to other parts of the body. So atherosclerosis can occur from the blood having a lot of fats in it. So these fats can stick to some parts of these pipes, and when it sticks to some parts of these pipes, it starts to harden, and the pipes, that's the arteries, now tend to lose their elasticity, and they have to start forcing themselves to be able to release blood or supply blood to the places like they should before. One of the places that this happens is the heart, the kidneys, and the brain. When it happens in the brain and there is occlusion of the pipe, like we are talking about, let's say a cement on the inside of a pipe that should be supplying water. So when that cement tends to fill the entire diameter of that pipe won't be able to supply water again. It gets blocked. Imagine if this happens in your brain where the the hardened fat has blocked your arteries. That part of your brain stops to receive blood supply. That part of your brain will die. That is stroke already. If that happens in the heart, you have a heart attack. That's what we call MI. That's a myocardial infarction. If that happens to your kidneys, that means that the kidneys are already bad and that kidney will stop functioning. And we start talking about end stage renal failure and all. This is not like an acute thing that happens immediately. This is a build up of bad decisions regarding nutrition and health. So we also have obesity and overweight. We have the mental health disorders. We have the sleep disorders. We have already discussed the circadian rhythm that can change when we don't take care of it. Insomnia. Well, sleep apnea is for people that's not A lot. So if you well, we usually say that sleep apnea happens in people that are overweight or obese, people that have added some weight. In the world of today, we tend to be a bit sensitive. Some people say calling them fat is, insulting. So we tend not to use those words. I would like to use people that are bigger than they should, right? So they can have sleep apnea. Sleep apnea is when we are sleeping and then you tend to wake up because you're not breathing well again. Like you stop breathing at some point, even while sleeping. And that can lead to poor sleep because you've been waking up because you were not breathing well. So in the afternoon, you now start sleeping again. So patient can have daytime somnolence because they didn't sleep well over the night. Usually for these people, we ask them to at least reduce their weight. We also check their nose and throat to see if they have some big adenoids or tonsils that is blocking their airway and making it impossible for them to sleep and breathe well at the same time. Okay, so this is a data that shows the burden of disease and the prevalence trends. We have the all of the uh, diseases that I've listed so far. I've tried to explain them so we'll have an idea of what we are talking about. And we can see that this continues to increase with time, especially the cardiovascular disease risk. This is the worst part because a lot of the time when the heart has a problem, it might be difficult to reverse that heart problem. It tends to progress and continue until the heart eventually fails. So we this obesity, the sleep disorders, the metabolic syndrome, they are still risk factors that can affect how your heart functions at the end of the day. Next, okay, so now that we talked about these diseases, we are going to talk about what we are going to do about them. So we have our lifestyle modifications. Lifestyle modifications are things that are within our control, things that we can do to improve the way our body functions. The first thing that I would like to talk about is nutritional lifestyle, especially because we tend to not take our meals seriously. Sometimes we forget to eat. Sometimes we eat the wrong things. Sometimes we eat less than we should, or we eat more than we should. Right? So we have to understand the important things that are necessary and that should be present in our food. We have the carbohydrates, we have the protein, we have the fat, we also have the vitamins, the minerals, we have water. Water is very important. Okay, also recognizing when we are not eating well and when we are overeating. If we are not eating well, we can be too tired. We will not be able to concentrate properly at work because the glucose level is low. So it's important for us to commit to a balanced diet and ensure that in the food that we are eating, every part of what makes it a balanced diet is present in the meals. So apart from our carbs, proteins, fats, vitamin, minerals, fruits, in the food that we eat, in the way that we prepare it, we need to reduce our salt intake. Our salt intake in this part of the world is a bit alarming, and that's part of the reason why we have a high level of prevalence in an incidence in the way blood pressure comes up. Like now in the clinics, we have people as young as 24, 20, 23 coming down with elevated blood pressure. That is hypertension. Now, hypertension is blood pressure above 130 over 80. If your BP is more than 130 over 80, you are already moving to hypertension. That is elevated blood pressure. I've tried to explain to us how fats can cause elevated blood pressure. Other things that can cause elevated blood pressure, I before we were taught that increased age would lead to elevated blood pressure, but that is no longer the case anymore. We're now seeing people as young as 2021 coming down with elevated blood pressure. Our race is a bit discriminatory, is more in blacks. which is why we have to be careful of what we eat. We have to be careful of how we live our lives. Smoking and alcohol, substance abuse have a way of affecting our metabolism and in turn lead to elevated blood pressure. Hypertension can be familial as well. If your parents were hypertensive, there's a very high chance that you too can end up hypertensive. So reducing salt has been noted to be implicated in elevated blood pressure. So we are advised to reduce our salt intake. So in our cooking and in trying to make our meals, we've noticed that we use a lot of sodium. Maggi has a lot of sodium. Lots of sachet spices have a lot of sodium in it. And the way to curb it is to use fresh produces and to reduce the amount of iodized sodium. That's the white one that we put in the food to say, oh, we want our food to be sweet, right? So one of the things to do, or one of the things that we've been advised to do, is that whenever we are cooking, when you can taste that salt in the food, when you can taste it and say, salt is already here, this food, I think the salt is okay, that salt is already too much. We are not saying you should eat something bland. No, you can use aromatic spices, really flavorful spices to cook your meals. But it's important that we take care of how much salt we put in. Half a teaspoon per day is the ideal thing for us. Water is also important because we don't want to be dehydrated. When you are dehydrated, you tend to give your kidneys too much work to do. Your kidneys are the organs that try to, concentrate urine, number one, at least keep your body in its optimal space, in its optimal state in regards to the volume of water that you should have. That's two. It also tries to clear waste products. That's the waste products that you now see in that urine. And for the kidneys to function, it is wonderful and it is nice for the kidneys if you drink water. It is recommended that you drink up to 3 liters per day. 3 liters, meaning that if you are taking that 150 cl of ever water, you should take two of it in a day. You can spice up your water. For some people, they say water is not sweet, so you can spice it up by putting cucumber in it, or strawberry, or lime, to make it have a nicer taste that would make it palatable for you, so that you can actually drink as much water as you can. So we have our exercise and physical fitness. We already know that we are prone to sedentary lifestyle. We are prone to sitting down in one place for a very long time in order to get our work done. Okay, so some of us may not be able to afford smartwatches that can remind us, but on our phones we can set reminders of every 3 hours you go about. Like, you just stand up from your chair and actually move about a little bit, then come back and do your work. This is a size, a normal exercise that you can engage in. It's not everyone that would be able to go to the gym and do both the cardio and the strength and resistance training. You can choose a kind of sport that is okay for you. For me, I do a lot of brisk walking. I can clock 20,000 steps in a day, like walking actually fast. No be trekking, actual walking. You know, we can decide to do brisk walking, we can decide to jog, we can decide to swim, we can decide to cycle. There are other kinds of activities that we can do that would keep us in optimum health. That's aside, going to the gym and registering for gym, if that is not what we like to do. Like I've already told us about standing and taking active breaks at least every few hours to help combat the risk of staying in one place for a very long time. Our social and mental health is important as well, because we have the risk of social isolation, anxiety, and depression because we are just alone in the house and working all day. It's important that we avoid alcohol and limit it to a very moderate intake. I stand corrected, but alcohol has very little benefits in medicine and it has very little benefits to your body. It increases your inhibitory system. Your inhibitory system is the one that will tell you, to not say something, to not fight, to not look for trouble, to not, to be shy, to not show your anger, to not, express all the negative feelings you have. That is what our inhibitory system tends to do. Alcohol reduces that inhibitory system, so it can make us prone to violence, it can make us prone to, you know some poor decision making, let me put it that way. So it's important for us, apart from the fact that it is one of the risk factors of diabetes and elevated blood pressure, which is hypertension. It is also a risk factor for chronic liver disease, chronic kidney disease, and and a constellation of sicknesses. It is advised that we limit and reduce our alcohol intake. Another thing is smoking cessation. Usually we say limit alcohol intake because, I mean, we have our liver that is working. If your liver is good and working, yes, limit alcohol intake. But when we talk about smoking, we say cease, stop smoking, because smoking affects our lungs, smoking affects our system, smoking affects our skin, it affects every part of our body, and it gives our body more work than it can do, to the extent that the lungs especially will stop to function and then look differently than it should. And when our lungs stop to function, it will reduce our lifespan. Other things in social and mental health, belonging to some social groups that can help us to unwind and all of that. The next part of our talk is the nutritional lifestyle. I've talked about how it's important for us to not skip meals or to not eat mindlessly. Poor nutrition can lead to low energy, low productivity, and this can be a vicious cycle. Let's note the signs of undernutrition: not eating as well as we should. Sometimes you are too tired, you are very weak, you are not concentrating well. You notice that your skin is always breaking, your hair is always breaking, you have a dry skin, you tend to fall sick all the time. It can be a sign that you're not eating well, right? Signs of overnutrition, signs of, excess calories can be, oh, you didn't plan to gain weight, but you notice that you're gaining weight, and it's because, and when you now trace it back, you see that it's because you've been eating more than you should. And when you go for some tests and they say, okay, let's check your cholesterol level, it's already high because you're not eating what we are supposed to eat the way we should eat it. Even there's also hypertension, hyperglycemia, and there's also tiredness because you're not moving about and you've gained a lot of weight, which may not be good. We have the balanced we have our balanced diet that we have already discussed. These are types of things that, okay, we can we can bring this down to Nigeria. What are the carbohydrates that we have? We are not saying you should cut off rice entirely from your diet, or bread, or oats, or fufu, or gari from your diet. These things should be eaten and can be eaten, and but they should be done in, in a very modest way. If you are if you're battling overnutrition, you might tend to think of calorie deficit. Eat in a way that your body has less work to do, because it still has to break down the excess weight that has been gained already. If you've been under nourishing, you would want to eat in a way to at least gain back the calories that you need to have in order to function optimally. So we have the sleep and circadian rhythm. Sleep is very important. Apart from the fact that our bodies are in tune with the way the weather functions, which is why once it's 8 p.m., 9 p.m. on a normal day, we start feeling sleepy because our body is telling us that we should go to sleep, right? If we now not sleep, we are now functioning against what our body is supposed to be doing on a normal day. Sleep is very important because that is when the brain tries to function. So when you read, the neurons in the brain connect to hold that information. And when you continue to read, that neuron that has connected begins to strengthen. It is when we sleep that we give the brain time to even strengthen the connections that we have made during the day. This is memory consolidation. That's when the brain will transfer some short-term memories to long-term memories while we are sleeping. So you can see that when we don't sleep, we will tend to be forgetful. We say, I forget so much, I forget a lot. And when you trace it back, it's because we're not giving our brain time to even consolidate what we have done so far. This is why some people will do crash reading. Maybe they do crash reading for 24 hours the day before. They'll go to the exam hall and they will fail woefully because they'll even be blank in the exam hall as all the things that they read, they didn't give the brain time to change that short-term memory into a long-term memory. The time our body is telling us to sleep, if we eventually sleep, that is the time that some regulations occur. Our body is cooled down, our body tries to recuperate, tries to build itself back. Are there cells that die? That is when those cells start to regenerate, start to reproduce, right? That is when our immune function is even improved because the body is now trying to build itself back. I mean, it has been stressed all through the day. When you are now sleeping, that is when the body is trying to get itself back to normal. So this is one of the reasons of one of the reasons why we need to take our sleep seriously. We are advised to sleep at least 6 to 8 hours every day. Sleep deprivation can lead to emotional dysregulation. You'll be irritable, short-tempered, body go dey pepper you. You'll be like, please, don't disturb me now, don't disturb me now. And if you trace it, it's because your brain has not rested. So you tend to be irritable, you tend to lose the normal tolerance that you would have. You don't know why little things are getting you pissed off because your emotions are not properly regulated and can trace it back to the brain not having time to rest. You have hormonal imbalance. I talked about cortisol dysregulation. Cortisol is the hormone that is released when our bodies are stressed or when our bodies need to continue to function, and it can lead to belly fat accumulation and immune suppression. These are the things that, at least, talking to laymen, they would be able to understand. Cortisol leads to other things, but at this stage, these are the things that we need to know about cortisol. Chronic sleep loss can also lead to elevated blood pressure, our heart's not functioning well, and it can also lead to cardiac heart attacks as well. So complications of sleep deprivation, when you sleep less than actually 6 to 8 hours every night is what is recommended for us. You can have diabetes, can have obesity, can have depression and anxiety, like I mentioned before, can also have hypertension. So we need to optimize our sleep and circadian rhythm. A lot of the time, one of the complaints that we have from remote workers is insomnia. One of them will come and say, doctor, I cannot sleep. Say, okay, why can't you sleep? Said, that once I sleep from 10, by 2 a.m., I'm already up and I'll be up pressing my phone until 6 when I need to start working again. This is not just for remote workers, even people that work in the banks, especially banks, people that work in corporate offices, they also come with these complaints. Now, on our own, usually we don't like to start giving sleep medicine immediately. We like to start with what we can do. We call it sleep therapy. These are practical interventions that on your own you will do them if they're no longer working. And then we do some sleep tests and we see that this is the reason why you are not sleeping well, this is the reason why you have insomnia. You can now be giving sleep medicine. Sleep medicine is not the first line of action for a person that is not sleeping well, right? So we have timing and consistency. Is when we now notice that we have this poor sleep, this insomnia, what we want to do is to retrace our steps. Let us go back to how our body is supposed to function. So you have to start training your body again to be in tune with the normal circadian rhythm. So you have to sleep and wake at the same time every day, even while on weekends. Set a timer. Once, if you're using an iPhone, you can have even Samsung too, you can have the bedtime alarm. Once it's 10 p.m., everything shuts down, so you go to sleep. you know Once it's 6 a.m., you wake up again. When you do this consistently for a month, and you would see that your body would pick up again with its circadian rhythm, and the stressors are reduced. You want to target 6 to 8 hours or 7 to 9 hours, you know, for both health professionals and for data professionals as well. You want to avoid taking naps in the afternoon. I know sometimes you may not have slept well in the night, so you want to sleep in the afternoon. When you now sleep in the afternoon, you now realize that at night you're still awake again, which is like a vicious cycle that never ends. So you want to wind down 16 minutes before bed. We usually advise this, an hour before you go to bed. You want to stop all forms of screen, the TVs, the phones, the iPads, the laptops, all forms of screen, they go away. You make your bedroom your sanctuary. There are no screens in your bedroom if that is possible. You screen, you make sure your room is dark and quiet, and to an extent as you can allow or as can be done, cold, so that your body is trained to at least wind down and prepare for rest. You can have a shower. We are advised to not drink water or eat like 30 minutes before you're going to bed, because that would keep you up. If you drink water and then you have to go and pee, and after peeing you come back, the sleep is gone already. You're advised to, if you need to read something of a hard copy, because you've taken away all the screens. Screen has a way of getting to the eyes and then keeping, and when it gets to the eyes, it sends signals to the brain that we are still functioning, especially with the light and how the light goes and how the graphics go when you're using your screen. So it tends to keep you up longer than you should. That's why we advise that if you want to read something, get something of a hard copy, with a warm bedside lamp. So you wind down and then you go and sleep. The environment, like I said, cold environment, as I mean, we are in Nigeria. Nigeria is quite hot. It's not everyone that has or want to have an AC, but and we have electricity problems too. So as much as we can, if we can get our room temperature to something colder than outside, it would help our bodies to wind down so that we can sleep. Darkness is very good. Darkness helps to release what we call melatonin. Melatonin is a hormone that helps the body to sleep, right? So you can use blackout curtains to keep the room quiet and dark, and when that happens, at least melatonin is secreted and then your body gets to sleep. Silence is important as well. Some people use white noise or they use earplugs, to try to drown all forms of outside noise. I mean, Nigeria, especially Lagos, is quite noisy. And that noise can actually wake you up from sleep. You need some level of silence to be able to sleep deeply and sleep as long as 6 to 8 hours. Comfort, use a quality mattress and pillow, to help prevent back pain and neck pain. So other things that we advise patients to do: to not take caffeine. Caffeine keeps you up. Caffeine is a stimulant. It keeps you up. Apart from the terrible benefits that it has on the heart, because it tends to increase your heart rate, and that is not okay. If you notice, if you take Monster or Bullet too often, sometimes your heart will just start beating really, really fast. And it's not good for our heart to lose its rhythm. Our heart usually has a rhythm that it beats on. It's not good for our heart to lose rhythm, and caffeine can make our heart to lose rhythm if we take it for too long. So it's important for us to reduce our caffeine intake. No alcohol before bed. Alcohol, in respect to sleep, when we take alcohol, it there is a hormone that stops us from urinating. Alcohol reduces that hormone. It is called antidiuretic hormone. But just know that alcohol makes you pee more. And we've already discussed that you shouldn't be taking lots of water 1 hour before you go to bed. If you now take alcohol, it will still make you pee. So that's why we are advising that you don't take alcohol before you go to bed. We've talked about no screen time, reducing your screen time, and then relaxation. You can practice deep breathing. Sometimes you count backwards from 100 to 1. I can't, well, I'll not promise you, but it works to a certain extent. Before you get to 70, you've already drifted to sleep. And by the time you wake up, you'll be like, oh, I thought I was counting, but then you have, you've had a good rest. So relaxation therapy helps to reduce, helps to put us to sleep. So we are going now to talk about what is within our control, apart from the sleep, nutritional lifestyle, the exercise, the social lifestyle. Okay, we have to normalize doctor visits. We should be able to go to the doctors. So for some of us that are lucky enough to work in places where we have HMOs, you are advised to use your HMOs. The companies are paying for it anyway, right? Use your HMOs, see the doctors, even when you do not have a complaint. Just a rundown of what you are doing or what you can do better is good for you. Sometimes you may not need to take supplements. You can eat your normal food and be okay. Supplements usually are for people that are lacking specific things. Like before you take maybe folic acid or iron or magnesium, you know, you might be lacking before you now finally start taking it. Supplements is not just for everybody to wake up and take. So you are advised to go see your doctors. Your doctors can give you, more information or advice or counsel on what you need to do. In that your annual checkup, usually when you go to the doctors, you get your blood pressure checked. That's when you will know what your blood, at least what your blood pressure is, so that when it goes up, you will know that this is not my usual blood pressure, this is a different blood pressure than what I used to know before. Cancer screening is important because of changes in the kind of food we eat. We started noticing cancers in younger people. We have breast cancers, we have kidney cancers, we have brain cancers, we have different kinds of colon cancers, especially, because of the kind of food we are eating these days, especially over processed meals. If you are eating lots of fresh produce, it reduces the rate at which your bodies would, grow cancers. So cancer screening is important for workers above 40 years, especially the men. You want to take care of your prostate. You want to be sure that your prostate is okay, is not enlarged or is not cancerous. For women, once you are up to 25, we have cervical cancer screening, we have breast cancer screening. On your own, you can be doing self breast examination to be sure that there is no nodule or tumor in your breast, anything that looks out of the normal. If you're looking at yourself every day, you'll be able to know when something is out of the normal thing, right? So once, if you're doing your self-breast examination at least 3 times a week, we usually say every day, but if that is not achievable, you can do it 3 times a week, so that when you feel something out of the ordinary, you can present to the hospital and then we can take it up from there. We have the mental health screening, that is for those that have depression and anxiety. So in that your checkup, there are some anthropometric measurements like your waist circumference, your hip circumference, and your weight and your height. Your weight and your height will help us to check your BMI, that's your body mass index. Body mass index is not the best way to know if a person is underweight, normal weight, or overweight or obese, but it gives us a good idea if if a person has a class 2 or class 3 obesity. It is point blank period, right? But there are some issues or some limitations with the body mass index, which is why sometimes we use the waist and the waist circumference. It helps us to know if a patient is adding too many abdominal fats, and abdominal fats can increase the risk of diabetes. So we have the reproductive health screening. Your sexual function is paramount in the in the way your body functions, because it's part of your health, right? So you're talking about your fertility status. Are you on contraceptive? Do you want to get pregnant? If you want to get pregnant, you need to see a doctor way before you start getting pregnant, because like before I started this presentation, I was already telling Mr. David that we noticed that a lot of the time if pregnancy is not well taken care of, we tend to have sick babies. And a sick baby would impact your work and your life as a whole negatively. So even as workers, it's paramount that before you start getting pregnant, you should at least go for preconception counseling. You are advised on what to do before you eventually get pregnant to ensure that your baby is healthy, right? So, next, this is about the reproductive health. So, in talking about women and their reproductive health, we have problems that come with their menstruation. It's important to see a gynecologist when you are having a lot of blood clots, when you have abdominal pain that is stopping you from doing your work diligently. If the abdominal pain is stopping you from functioning as a person, you need to present to the hospital. There are lots of reasons why your that is happening, and it needs to be examined, it needs to be assessed, and it needs to be reviewed by a healthcare professional, right? If you want to be on contraceptives, if you want to, if and knowing that contraceptives have their own advantages and disadvantages, it is not okay for you to make that decision on your own without knowing what can happen, like the side effects of the drugs that you're taking in order to prevent pregnancy from occurring. For men, like we talked about the metabolic dysfunction can also lead to erectile problems. It can lead to lower testosterone, it can lead to reduced sperm quality. And like I said, prostate health is important for men above 40 years. So, but at least at the time you are 40, you should have seen a doctor. Even though they don't do any tests for you, at least see a doctor and discuss your health to know if you need to be, on your prostate. Because one of the things about prostate is that it's familial. Familial meaning that if your parents, if your dad or your uncle or your brother had prostate cancer, there's a high chance that you might have prostate cancer too. So it's important that you come in early so it can be sorted out. Okay. So now we've talked about what we can do as workers. For the managers amongst us, we have to find a way to limit burnouts. We can help our workers to have a good health seeking behavior. At least help them to set more, good healthy boundaries. You cannot be not you cannot be, but it would be nice if you don't have to send in mails of work at times when your worker should be out of work, pulling them back to work and, you know, make destroying the boundaries that they should have set between their health and their works, right? So flexible work schedules is also advice for people that can do so. Mental health support, at least, so that when those people that have anxiety or depression and people that have some deadlines to meet and are not able to meet up, forming a mental health support and being a good leader can help them to work through those challenges. Regular check-ins, regular reminders for good health seeking behavior, wellness programs. Some good managers would want to do some gym subscription for their workers to help them to stay fit. You want to prevent social isolation. For managers that can, it is advisable that you bring your workers to work. I mean, you are doing remote work, but you can decide that once a week everybody comes in, to interact socially, to prevent social isolation, to and form a community that is sustainable and goal driven. So give your people realistic workload, give your employees realistic workload, because burnout can lead to unsustainable workload. You want to track the actual hours and ensure that they are not overworking themselves. You want to lead by example on preventive care. If you are going for your health checkup, advise them to go for their health checkup as well. It will be very important. Now, lastly, what are the red flags? When do you need to see your doctor? Like I said, you need to at least know how your body functions on a normal day, so that when it is out of the ordinary, you can come to us and then we can investigate further. Pain is a signal, it is not a nuisance. Any pain that is not immediately explained by trauma, maybe because you hit your hand or your leg somewhere, it requires or warrants investigation. Chest pain can be from anything. Chest pain can be from the ribs, it can be from the muscles, or it can be from the heart. So it's important that you seek care immediately. At least when you come to the clinic, you, the doctor, depending on their expertise and depending on what they see in front of them on their examination, they can decide, oh, do you require an ECG? Do you require a chest x-ray, or do you just require analgesics and reassurance? Lower back pain is, it can be just okay, the muscles are contracting and that's what's causing you pain. And it can be that your spine has shifted and is impeding on the actual spinal cord, and that is why you are having that much pain. So it's actually important for you to come to the clinic, come to the hospital, so that the doctors can know what they are working with. A good doctor will be able to know if your pain is from muscles, or the pain is because the spinal cord is in danger. So headache, you don't want to stay with headache for a long period of time. Like I explained before, that headache can just be a mild headache because you have not eaten, headache because you've not slept well, headache because you've not drank, you've not taken a lot of water, or headache because you are getting a stroke. It's important that if you have a headache that you think it is out of the ordinary. Sometimes there's what we call subarachnoid hemorrhage, that is brain bleeding. So before that brain bleeding occurs in patients, they usually have the headache that is like the worst pain in their entire lives. That is how they describe the headache. That headache was like the worst pain in their entire lives. We are advised to come to the hospital immediately so that at least your blood pressure can be taken care of, and we have specialists that can attend to you and make sure that you are okay. Abdominal pain can be anything. It can be from ulcer, it can be from appendicitis, or it can just be because you didn't eat good food. Maybe you ate outside and there was food poisoning, and your body is trying to shed all of that poison, and that's why you're having the abdominal pain. Like a lot of the time, things can go from just 0 to 100, and you may not know which one you're working with. So it's always advisable that people present early to the hospital. Shortness of breath can be anything. It can be because you are not breathing well, just because you're not breathing well, or you have catarrh, or you have cough, or it can also be because you're having a heart attack. Okay. Night sweat can be from a lot of things. It can be from an infection, or it can be because the weather is hot. So, like I said, know what the ordinary is, so that when something is out of the ordinary, you'll let us know. We've talked about the red flags, right? Headache, fever, neck stiffness. Okay, so these are I've tried to explain what the red flags are and what we need to come to the hospital with. Now, one of the things that I don't think I mentioned is eye pain. Because we tend to spend so much time on the screens, we want to be seeing the ophthalmologist too. It's important for us to use some screen guiding or screen blinding glasses to reduce the amount of rays that we let into the eyes when we are using the screens. So when we have eye pain, it's important for us to get to the hospital. Eye pain can be from maybe conjunctivitis to glaucoma, and it's important that you are examined in the hospital so that the doctors know what they are doing. So it's important for you to start today, get a schedule, take nutrition seriously, take exercise seriously, take your sleep seriously, drink 3 liters of water every single day. Change your diet to something that you can actually work with. Work with things that are around you. Is advised to use fresh produce. I mean, if you can cook, use fresh produce. If you cannot cook, go to restaurants where fresh produce is used, right? Try to achieve up to 8 hours of sleep every time. Exercise at 150 minutes of moderate activity, every week. This 150 is usually say, okay, you can do 30 minutes every single day, right? Or 1 hour every 3 days for every single week. Preventive care, go for follow-ups, go for lab checks, go for health checkups, right? In conclusion, our body is a system of different parts, of different units, and like any system, it requires maintenance and it requires prevention of disease occurrence. Symptoms just tell us that something is wrong, and when we present early to the hospital, it helps us to know what to do. Remember that your health is not a luxury, it is the foundation, and it's important to take our health seriously. Thank you.
Thank you so much, Dr. Winnifred. Thank you very much. This has been very impactful. I have even gone to wear my eyeglasses now. As a doctor. Thank you so much. Thank you so much. I know we are right on time, and I'll probably just take one question. If anybody has one question, just one question. Does anybody have any question? You see it as a possible consultation even without going to the hospital. So take it if you need it. No question. All right. So, doctor, one question for you while you were talking. Okay. Okay. Yeah. Great.
Yeah, thank you so much, doctor. This is really free consultation that we're getting without paying anything. Really appreciate you spending your time with us. I have a question which I'm just curious from your expert opinion. For context, I have like a BP monitor at home, which I also use to regularly check just to ensure things are not outside of the ordinary. But I tend to observe that each time I go to the hospital for some reason, maybe I'm not feeling well, and they check my vitals because he said something earlier that when you see the number they check for you, you can know whether it's outside of the range you often would see. So I would often see that when I go to the hospital when I'm not feeling fine, and I do my vitals, it's always way outside of the range of what I often see regularly when I'm doing it at home without any pressure. So just curious, any indication or what might just be at play here, and probably when I go back and do it myself, it's always different.
Okay, do I take the question now or take all the questions at once?
Or I think you can take everything at once. Let me just add mine. So my question was, would change of lifestyle reverse issues that may have come up due to bad lifestyle, like probably sleeping, nutrition, sedentary lifestyle, and so like that. So would a change of lifestyle over time, would it likely reverse everything back to normal over time? So I think that's all we have.
Okay. So when it comes to blood pressure, yes, it's good to check your blood pressure at home. But we are also going to talk about the technique too. If you are in the hospital and you came to see me, I want to ask you how you what kind of blood pressure machine are you using? How do you put the blood pressure? Like how do you put the blood pressure machine on your body to measure it? So I'll know that you're doing the right thing. That's number two. Then number three, we have what we call white coat hypertension. That is your BP just goes up just because the doctor is the one checking it. Just you just have anxiety and you're worried about what would the number show, what would the number show, and then it just shoots up immediately. Then later when you get home and you check your BP again, it becomes normal. Yes, it's important for you to tell me what your numbers have been and what numbers do you get in the hospital. If you've been getting 120 over 60 at home and then you get 120 over 80 in the hospital, I won't be worried. And at some point, if your BP is up like more than 130, 80, your doctor should have raised alarm already, so that you know what you need to do to get your BP normal. So in terms of reversibility, some things can be reversed, while some things cannot be reversed. Like we were talking about, how fats can cause, clots that will block arteries. When we start eating right, those clots may not ever go, but if the rate at which they were growing before to be able to block the arteries will just reduce. But if the clots were very little, it can be reversed in the sense that the body will find a way to, separate all those fatty clots, and also the arteries are not blocked again. So it depends on the level at which the disease has gotten to. At some point, it is no longer reversible. But if it's at the beginning, at the beginning stage, definitely we are able to at least reduce the progression of the disease and reduce how badly it can get. Do you understand?
Yeah, 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 yeah.
Okay.
All right. Thank you so much, doctor. Thank you so much. And one final rapid fire question for you just before we go. Just very rapid fire. Coffee or tea?
T.
Okay, gym or home workouts?
Hmm. Home workout.
Screen time limits, yes or no?
Yes, I'll be a screen time limit.
All right. And best health advice you have ever gotten as a doctor?
To take my health seriously.
Gee, I think that's summary of everything we've heard here. Don't wait until the doctor calls you. Go and see the doctor yourself before you are taken to the doctor. So thanks so
Okay.
much, Dr. Winnifred. Thank you so much, everyone.
Mhm.
I really appreciate. And we'll share more information as regards our next webinar. And
Okay.
enjoy the rest of your weekend.
Okay.
Bye.
Thank you. Bye.